Uh, Dr. Wong, Charlene, welcome to Latin 19 again. Welcome back to Latin
Yeah,
19.
muchas gracias. Hola. Vivian, it's great to see you, and Rosa and so many friends. So thanks for having me back. I will be talking about a very different topic. I believe, Viviana, the last time I came, it was when we were squarely in the, peaks of various COVID-19 surges. And I was sort of speaking more in my prior role, which was as Chief Health Policy Officer for COVID-19 at the department. So I'm here today in a different role as Assistant Secretary for Children and Families. And I just wanted to share, I was asked to share a little bit of information about a new and exciting division that we have launched at the Department of Health and Human Services. It's called the Division of Child and Family Wellbeing. And so, Viviana, you just let me know when I need to stop, but I just have a very short deck to provide an overview of the division. And then I'm very happy to take questions as well and think about how we can coordinate with Latin 19 and really serve all families and children in North Carolina. All right, are y'all seeing my slides? Yes, okay, great. All right, so we in the Department of Health and Human Services have had a vision for children for quite some time. And this new division I'll be talking about today really builds upon that. And hopefully this is a vision that resonates with all of you. We are seeking a vision that children are healthy and thrive in safe, stable, and nurturing families, schools, and communities. And I know the last talk was just all about really working very closely with communities, and we certainly are aiming to do the same within the department and specifically within this new division. This is part of realignment and reorganization at the department, which is really aimed at building a stronger and more integrated Department of Health and Human Services. So you can see on this pretty rainbow slide here, we have several different pillars within the department and the different divisions and offices. And this new division I'll be talking about today is the Division of Child and Family Wellbeing, highlighted here, which is within the Opportunity and Wellbeing portfolio. I will mention that one of the other divisions that I oversee that also has a huge influence on children and families, all children and families, is the Division of Child Development and Early Education. And that division deals with things like subsidies for childcare and pre-K programs. So again, programs that are really important to so many children and families in the state. And in exciting news, our new Secretary of Health and Human Services at the North Carolina Department of Health and Human Services has 3 major strategic priority areas, and one of them is children and families. And within our strategic plan and our departmental and the secretary's strategic priorities, there is one that is specifically listed as improving child and family well-being so that all children have the opportunity to develop to their full potential and thrive, which includes building a stronger infrastructure. And within that includes establishing the division I'll talk about today, which is the Division of Child and Family Wellbeing. We are also doing work around data infrastructure, and I'll talk a little bit about one example of a project that we have underway now to really increase access to particularly nutrition benefits for children and families in North Carolina. And then we are also doing a lot of work to try to better address and increase access to children's mental health services. So why did we establish this new Division of Child and Family Wellbeing? It is really sort of at its core to support this concept of whole child, whole family health in North Carolina. And when we say whole child, whole family, whole person, you guys maybe have hopefully heard that concept before. For children, we're really thinking about meeting their health, social, emotional, and in many ways also their educational needs of children and young people and their families. So launching this new division, we're really working to enhance coordination across programs. By doing that, increased coordination will allow more families to access programs across mental, social, and health services. And I'll talk a little bit more about some of these nutrition program work that we have underway now. We're also working to coordinate, it's wonderful time, increased investments to improve child health and well-being. We're very much looking to make data-driven decisions and focused on closing the unfortunately many equity gaps that still remain in child and family well-being. So coming out of COVID, we've been doing a lot of work, for example, with the American Rescue Plan funds and really coordinating those to maximize the impact of that additional funding that is coming down to the states. And then finally, I think as all of you all can very much appreciate, and again, talking about working with the community in the last presentation and listening to the community, certainly we're hearing in our own teams, in the teams of our partners, everyone has done an amazing job during the pandemic, serving children and families, and are very tired. So we are really working to create that thriving culture amongst our own teams and the teams and working with our partners so we can really celebrate and continue the important and often hard work to have the impacts we want to have for children and families. So most common question we get asked after why did you establish this? Well, what's in it? So here are the programs and the sections within the Division of Child and Family Wellbeing. So hopefully you'll get really excited by seeing some of the things that are listed here, which include food services, nutrition supports, and then also physical and behavioral health supports. So again, this concept of whole child, whole family health. So we have a section for our FNS, or Food and Nutrition Services. Also, some people know this as our SNAP program, our North Carolina SNAP program. Some people also might know this more as our food stamp program, but the title that we like to use is the Food and Nutrition Services program. We also have our Community Nutrition Services section. So this includes our program for women, infant, and children, or WIC. So you all may be most familiar with that for children, young infants getting formula, for example, and that is a program that supports nutrition for young children and families, as well as women, pregnant women. We also have our child and adult care food program, which includes things like for after school programs or congregate care settings where they can get nutritional supports. We also have our section on early intervention, also known as our infant toddler program. And this provides supports and services to children birth up to age 3 with developmental delays or other established health conditions. And then, we're really excited. We have a section that we have newly named the Whole Child Health section. And this includes both physical and behavioral health programs, because as I'm sure you all know, physical and behavioral health are two sides of the same coin. And so our behavioral health programs include those that are supporting school and community mental health services. And then for our children and youth programs, this includes programs like our school health promotion, home visiting programs, supports for our children and youth with special health care needs, our CMARC, or care management for at-risk children, amongst a host of others. So this whole child health section has a lot of different programs in it that support physical and behavioral health for children and families. Here are two of our top priority areas. One is to reduce food insecurity among children and youth through increased access to nutrition support services. And I'll talk more about that in just a slide, just to give you guys a little bit more detail on one program. We are also doing a lot of work, as I mentioned, to increase access to children's behavioral health services. We're doing quite a bit of work right now, thinking about schools and what we can be doing in partnership with schools to better support students' behavioral health, as well as in primary care and specialty care. Here's leadership with some nice photos here. So that's me. And then we have a wonderful new division director, Yvonne Copeland, who just wasn't able to be here today, but I'm sure she'd be happy to come back to meet this group at a later time. And then also someone actually who came from Duke, Madhu Vulamiri, is our deputy director, and she was previously a graduate student at Duke. So I won't go into this in detail, but all to say, as you might imagine, launching a new division is a pretty monumental task. We've been working on it for quite a while, and we just started launching this new division this calendar year, and that's work that continues on today because we're still in the launch period. And so, as I mentioned, I was going to just do one or two more slides on this addressing food insecurity being a top priority. We are now one of the only states that has both our WIC and our FNS programs in the same division or in the same silo or home within the state. Most other states have them split up into two different areas. And this really presents a wonderful opportunity to work across these two very large, very important nutrition support programs for children and for families. And so we right now are doing work to match or link data across that food and nutrition services, WIC, and Medicaid, because we know that there are families who are perhaps enrolled in one of those programs, likely eligible for another. So say you've got a family who is in Medicaid. We know because of their eligibility for Medicaid, probably they're also eligible for FNS, but they haven't enrolled in that. And we've identified them as being food insecure. Doing this type of matching of data across these will allow us to identify those eligible but not yet enrolled in program families, and then be able to do tailored outreach using our data to inform outreach strategies. I will mention for Latin 19, one of our hypotheses going in is that we believe that there may be lower enrollment among eligible families who are primarily non-English speakers because of all the different things, the hoops that you have to go through to get enrolled in these programs. And so this would be an area, for example, where we'd be very interested if our data bears that out, which we are anticipating that will be the case. We would love to connect with some of you all to help really think through and what would be some of those tailored outreach strategies that we should really think about using so that we are increasing access and equitable access to these really important WIC and FNS programs. I'll give you another specific example for WIC. We have pretty high enrollment for kids who are under age 1, so infants, but then we see this pretty steep drop off because people just don't know, families don't know that they can continue to access important nutrition supports after their child has turned 1 year old. And then again, all of this is in the spirit of wanting to make it easier for families to enroll. And again, some of the things we're looking at the department level is trying to make sure we have increased language access, both Spanish, but also other languages, including American Sign Language, for example.